Hi there, Dr. Tansavatdi here. Today we are going to be performing Sculptra injection for facial rejuvenation. I like to say that this filler is almost like producing a mini lift, and we're going to just demonstrate that today with our nurse Susan. And I've made some markings on the face so you can see basically where we're going to be injecting today is lifting up the cheeks because she's got some marionette lines and some sagging here. I am going to be doing in the mid face as well as the lateral cheek. I've marked out where she has a little malar mound here. There's just, I don't want to inject there. That's an area that I don't want to inject. These are the areas that I'm going to inject and where I'm going to start inserting from my cannula. And that's, with this, I use a blunt tip so that it's less likely to bruise. And typically with the Sculptra, I use a cannula technique. All right, so we're gonna get started. She is very strong, I don't know how she's doing this because I'm so afraid of needles, so I don't know if I would be doing it this way, but we have no numbing cream on, so you can see exactly what volume we get as soon as we inject, okay? So I'm gonna start there. I always like to start on the upper face before I go to the lower face because she's got marionette lines and this pre-jowl area. I wouldn't do that until I do the second syringe or second vial. The first vial is I always start with the upper face and I work my way down because whatever we do to the upper face will have an effect on the lower face, okay? So here we go. I'm gonna wanna mix this really well. We've already kind of put the product in, but it's a powder. And I don't know if you can see that, but it's very cloudy there, and I want a good distribution of the product. The product can clog the cannula sometimes, so I like to get it well mixed so it doesn't clog. And then the technique with this is that we want to go in and out very quickly. We don't want to wait too long or linger, but we also want to fan the product over the whole area. This is as close to or very similar to my injection of doing fat grafting. And fat grafting is, are you okay?
Perfectly fine.
Wow. All right, so it's deeper than I've done the injection with Restylane, which was in a different video. And for more information, check out the one for facial rejuvenation in a 3-part series that we do for under eye rejuvenation with Restylane. But here I'm using Sculptra, and I'm using the product to kind of lift up the cheek. I've said before that the cheeks are actually the base for the under eye. So if we could put volume in the cheeks, it kind of supports this under eye area. So I'm doing again in the marked areas that I've already marked out. And sometimes you want to just take a feel of where the inferior orbital nerve is. I'm not deep enough to cause any problems there, but some patients can feel a little numbness when we're in that area. Okay, so we're done with this. I'm going to do a little injection starting from here now and work my way doing this lateral cheek. Okay, and this injection is combined with lidocaine and sterile water. That's what the product is mixed into. And see, this is where I don't want to inject. That's where she has got a little malar mound there. So, doing in this area. And I also like to go right along the zygomatic arch here. And this kind of gets that trajectory to lift. Okay, so that's good. All right, we're good there. And there you have one side compared to the other side. Very full right now. A lot of that, can you see already an improvement in the marionette line, just a slight lift from that. Again, a lot of this is water, so this volume will go away. Sculptra is a product that you need to build up over time, so we like to do this in a series. So the first time I usually do 1 vial, and then we spread it out over 4 to 6 weeks. We do the second vial, and then possibly a third vial at the third treatment, depending on the amount of volume loss and the amount of aging that we're dealing with, we might be up to 5 or 6 vials in total. And that sounds like a lot, but in reality, what we're doing there is getting a result that lasts you 2 to 5 years. So with that type of result, you're going to need more of this particular product, but it gives such a great result that's very natural and it looks very similar to using fat grafting. So if you want something that doesn't have a lot of downtime and looks natural, this is the product for you. All right, so now we're going to do the other cheek. Again, starting in this lower part because I'm adding up to this upper cheek. She has a little bit more volume loss on the left side, which is very common for most people. The left side tends to be the side that is more weak because, well, we get more sun on that side. So the sun exposure is what creates some of the aging process and laxity of the skin. So now that we're done, you can see the volume in the face. Our main goal was to address the under eye area, just to lift up the cheeks to support the under eye area. We'll come back later to add a little more volume under the eyes with a Restylane product there. But after Sculptra injection, the aftercare for this is the day after. She is going to start massaging the areas pretty firmly. So I'll kind of show you in the video here. It's going to be firm pressure right down onto the bone because the injection was deep, right there and right there. So she's going to sweep along this area that I've marked, and she's going to do it 5 times a day for 5 minutes each time and for 5 days. Okay, 5 times a day, 5 minutes each time for 5 days. All right, thank you for listening, and for more videos, please tune in to our library on YouTube. Thank you.